There it is, Amy. It now says this meeting is being live streamed. It should say the same on yours.
Got it.
Jolly good. Amy, just bear with me 1 second while I just check that this is going through to my Facebook page, because what happens then is I can see comments as they come up. And maybe if it goes like that, we can answer some questions that come up in the comments. How does that sound?
Good, yeah. I can't see any, but you can see okay, yeah?
I can, yeah. I'll if you go onto my Facebook, because I'm looking at my laptop. Here we go. I think we have it now. So that's the first bit of a setup. Amy, my love, it's so lovely to see you. I've been trying to get hold of you for ages and get you on here, but for some reason you've been like, every time you see me, you hide behind bushes and stuff like that. What's the reason for that then?
Was it that obvious?
Yeah, absolutely. So I've got a feeling that we share lots and lots of different interests, although we've not sort of formally met to discuss them. But the whole purpose of this show is it's called Getting Real with Dr. Joe, because personally, I think we live in an upside down world, you know. And my personal history, without boring everybody to death, is that in 1987, I had what was called a psychotic episode or two, or that's what it was called at the time, you know. And that was the time of something called apparently the harmonic convergence, right, where some sensitive chaps like myself, their heads opened up and information piled in, and I just couldn't handle it, you know. I wasn't emotionally ready to process the information that was coming in. So I was trying to throw myself off bridges, you know, the Mersey Tunnel Bridge and stuff like that, you know. And I made 3 serious attempts to do myself in, but obviously didn't work. But for some reason, they sent me to the psychiatric department, right, at Wirral University Teaching Hospital. It wasn't called that then, but I ended up being sort of hospitalized 3 times, really, in a couple of year period. But I was heavily medicated, and I you know, I was almost like largactilized, you know, so I was like walking around with my hands on the floor, you know, and I didn't have a clue what was going on. And it was really in the last time I was in there, the process has started to unravel in, because an occupational therapist and a staff nurse got hold of me, and they started to ask me questions in a way that they'd never asked me before, you know. And I realized now that this was all part of something to do with Carl Rogers' humanistic approach, really. And rather than telling patients what to do, they started to ask clients, you know, because all the names changed, didn't they? We went from being a patient to a client, and now I think they're called service users now or something, you know. Yeah. And I think I just said, if you just call me Joe, that'll be fine, you know what I mean? Yeah. So I've realized, looking back, and I don't knock the medical profession at all, but I do think that there are people a little ahead of the game, right, who are more sensitive, who can sort of pick up what's coming up in the future. And I think medicine's changed such a lot. And by the way, just to say to the audience, you know, I'm not a doctor of medicine, I'm a doctor in medicine. And all that means is that I'm not a prescribing doctor, but I've got a PhD in medicine. And my PhD was about really how the heart works and how it's connected to the brain, you know, and then that became mind body then. And I start to understand this, the way that we think impacts upon the way that the brain works, you know. So it's almost like thinking is in an invisible dimension, but how we think impacts upon the way our central nervous system works, which then sends information down our nervous system. I'm being a bit technical because I think there'll be people on here who sort of quite like that side of things, you know. But to cut a long story short, you know, I got addicted to alcohol, but I'm just coming up now to 33 years clean and sober, you know, and it's become very, very important to me that I lead a clean life, you know, and that means it's not about morality, this, you know, Christ, because otherwise I'd be lost, you know what I mean? But it's about, right, becoming really, really sensitive about what I eat, what I drink, what I ingest, what gets injected into me, right? And so I try and keep my life as clean as possible. And what tends to happen is, in that state, I'm able to maintain a sort of emotional calm and a clarity that I never had before, you know. And Aimee, I didn't know, you know, I look back at that person and part of me feels sorry for him, but I just didn't have a clue, you know. And I've got to be honest, you know, in my drinking state, I hurt a lot of people. I was like horrible, you know, I was so terrified, right, that sometimes it came out in violence and stuff like this, you know. And I used to wake up the next day and think, what's the matter with me? But it was really a case of get away from me, you're coming too close and all that, you know. And I'm sure that you see that. I'll shut up in a minute and give you a go. But that's my background, you know, and where it took me from, I was a biomedical scientist on the Wirral before that, you know. I was my specialist area was hematology and blood transfusion and all that sort of business. So I was quite well grounded. I was a lecturer in biomedical sciences, and I was quite well grounded in the science side of things, but none of that information helped me at all, right? You know, it didn't. And I almost had to jettison that. And I got the sack from the hospital for being drunk on duty, you know. Yeah. And I said to them, please don't sack me. I'm going to do everything I can. But at the time, you know, alcoholism wasn't really seen as an illness. It was seen as a nuisance, basically, you know. And so they were quite unsympathetic to my cause. And I got the sack, you know. And it was a job that I loved more than anything, you know. I loved it so much, you know. Anyway, to cut a long story short, I came across a different path then. I was guided into sports and exercise science, sports therapy, massage. And then from the massage side of things, I got into something called Indian head massage, right? And my head was saying, what a load of old bollocks this is, you know. And somebody said to me, listen, when you had an Indian head massage before, how was it for you? And I said, I've never had one. It won't work for me. And they said, do us a favor, just have one and see what happens. Changed my life. Changed my life. Because I was introduced to all these energies, and then I was introduced to Reiki, and then I became a Reiki master. So that's where I'm up to now. Part of me is a PhD in medicine, but the other half of me is like a Reiki master who believes that there's lots of invisible forces that we can call upon in order to guide our step one breath at a time. There's me. I'll try and shut up now. What have you got to say about that then?
Where do I start?
Anywhere you like.
Let's see, yeah. So yeah, a little bit about myself, really. Similar, obviously, for those who don't know me, which is probably many people. Hi, I'm Aimee. I'd just like to say, just because it might come across, I'm dyslexic and I'm dyspraxic, and I just put it out there in case I sound like I'm tongue-tied or I'm needing to get my teeth in. So I'm just putting it out there. But sometimes I think by saying it, am I not helping myself? And I'm putting the words out there in reality. So yeah, just letting you know anyway, in case I sound like anything. But yeah, so I have been a qualified mental health nurse. I've worked in the NHS for 20 years now. And I'm dead lucky. I'm just really passionate. I've literally landed what I believe to be my dream job. So I specialise in working with people with psychosis and unusual experiences in the NHS. But I'm really lucky that I work in the community team. So yeah, we've got doctors and we've got medicines, which we're really lucky to have in some cases. But within the early intervention team, we work like holistically with people, we work individually with people. And I'm really lucky that I get to do things like today on a Thursday day, we've been walk to Hilbury Island and back in this beautiful weather. We had a meditation, we all connect. Sometimes we'll go and do like a cold water dip in. And this is the way that people are healing themselves. And it's just amazing that I get to see this, that some people do go down the antipsychotic route because that's what they require, but other people who are having these experiences, whether it is psychosis, whether it's spiritual awakening, to me that's just a word. It doesn't matter what the word is. It's more how that person feels, how they think, how they behave, and if they feel like they're thriving or not, and the well-being. So yeah, I'm just really blessed that I get to see meet all these amazing people and just watch them on their healing journey, just using all these skills in this modern day. And what got me into this path, so 10 years ago, a bit like yourself, I was putting anything in my body, on my body, sort of not thinking anything of it. I became pregnant, then had my spiritual awakening, stroke, major depression, a bit of a mixture of everything. Being pregnant, I was really aware again of what I was putting in my body. My GP just give me a sick note and give me loads of script of medications, some diazepam and antidepressants and all this stuff like this. And just being in there, so I just thought, there must be other ways to this, again, because of the medications. And someone said, have you ever heard of Reiki? And I was like, oh, what's that? And it sounded like a load of woo-woo, a bit odd and a bit unusual, but I thought I'd give it a go because I had nothing to lose. And a bit like you said, when you had this Indian head massage, it's just literally, without sounding really cheesy, changed my life. Another fear that I have is opening my mouth and speaking. And yeah, the Reiki just give me so much confidence. Well, not the Reiki, this spiritual path of healing and self-development and breathing in the light and letting go of all that. I'll be allowed to swear.
Yeah, definitely.
Yeah, breathing out the shite. So you've heard that one before.
Yeah.
So yeah, and it just changed my life. And then I thought, wow, more people need to know about this. And at the time I was a full-time mental health nurse, as I say, and then I whipped my hours down to 2 days a week, and I had the extra time to then train in things like Reiki, shamanic Reiki, crystals, meditation, cold water dipping, all that stuff. And I started doing it in a business with people who struggled with mental health, and I thought, wow, this is amazing. Started doing it with children, and a lot of the children that I work with, Joe, are actually on the CAMHS waiting list. And as we know, unfortunately, I thought the children were going to be quite tough and resistant through COVID, but I was so wrong, as many of us know. And a lot of the kids are on the CAMHS waiting list, and it's like 12 months or so when we meet, we set our goals, we do things like Reiki and meditation and mindfulness. Within 3 sessions, they're smashing the goals, and them and their family don't even feel like they need CAMHS input anymore by the time it comes around. And it's just opening my eyes to this amazing world, and I just feel really passionate about sharing it with other people. And yeah, my passion is the womb space, so starting really, really early. So I work with mums and children, but it's important to get in there early, as you know, really get in there in the womb space. I come from a lineage of tainted, a female bloodline, tainted female bloodline. So myself, my mother, my grandmother, my great-grandmother, probably further back, had struggled with mental health problems, addiction, abuse, you name it. And I never wanted to become a mum because I thought, I don't want to pass this poison chalice down. It's not fair to put another human through this. And then again, through this awakening, this amazing work that I've did, I feel like I've literally been cleaning and cleansing all that trauma, all that shite, all of that. And I am a mum, and my daughter is the most beautiful, little, happy, light worker ever. And it just, yeah, the proof's in its pudding. So I had my own breakdown, but found the light of this amazing stuff. I'm very grounded in my experiences. So a lot of people that I work with have these amazing gifts. I see them as gifts in your senses. I don't have anything like that. I'm very grounded. But yeah, I'm just really, we can't ignore that this stuff is amazing for mental health, and we need to get it out there. Yeah, that's me.
You've got loads of gifts that are just flying out of you, isn't it, really? Because your enthusiasm just carries it through, you know. And by the way, on the swearing thing, you know, they call me Dr. Effing Joe, you know, because when I get carried away, I just can't help myself, you know. So when I'm going to give talks, because I'm still a sort of lecturer in postgraduate medical education at Edgehill University, you know, so there's almost part of me there, you know, and I can almost like feel the words coming out, and I've just got to nip it in the bud, you know. But what I'm doing over there is I'm introducing mindfulness, right, as a sort of stress management tool, because everybody in the NHS, right, is falling apart, basically, you know, unless it's those who practice mindfulness, really. You know, it's the people who practice these techniques that we're going to be talking about who are actually going through and finding it difficult being able to but being able to still navigate and help other people as well, you know. So we'll talk a little bit about that. But I think more than anything else is what I learned is very, very simply is how our breathing is intricately connected to the way that our heart works, and how our heart works is intricately connected to the way our brain functions. So the thing I'm passing on now is not cognitive behavioral therapy. Not that I'm opposed to that, because in some areas it's very useful, but I'm going to turn that on its head and show people how you can change the way your heart works to change the way your head works to take you forward in life. So not only do you, I'm going to say words that don't mean much, but not only does the heart open and provide you with more courage and self-worth, but it also changes. And there's loads of neuroscience behind this.
Sorry.
That's all
Sorry,
right.
it's just that it's
She's gone. She's gone. We must be being attacked by the opposition or something. I'm sure she'll be back in a moment. Yeah, so just to say, you know, what I found through my research is that through breathing in a certain way, and also by introducing a positive occurring emotion, we can actually change the way our brain waves work. And as a consequence of that, we can change the way our habits, old habits can be kicked out and positive habits can be brought in their place. So by using a positive emotion, we can almost like chase out and work behind old habits and stuff like that. So I'm not sure where she's gone, but I think what we'll tend to talk about is we've got a lot of other interests that we overlap with. So hopefully we'll get to talk about some of that stuff as well. And maybe resistance, you know, because I've faced over the 30 odd years, I've faced quite a lot of resistance to this. And what I've tried to do now is find out the sort of the medical evidence and the scientific evidence behind some of these so-called woo-woo things, you know. So I call them non-medical interventions that have got quite a bit of neuroscientific evidence behind them. I don't know where she's gone. If you just bear with me 1 second, I'll see if she's able to, if she's come up on Messenger. And if not, I don't know what we'll do. We'll just have to play it by ear. Aimee G, there she is. Everything okay? Obviously it's not, right? Oh, hang on. I think she's come back. Diddly bum bum bum.
I'm back.
You are. Now we've got that echo.
Okay, maybe let me 1 minute. The phone was on this side. Does that make a difference?
Yeah, that's better. That's now a landscape. Yeah, that seems to be working okay. Yeah, I was just saying, nice to have you back anyway. I was just saying that what I found out from a neuroscientific point of view is that if we can change the rhythm of the heart, that sends different signals back to our brain then. And because the heart is a bigger, what they call oscillator, it's got much more power then to actually change the way our brain works. And when we use breathing in a certain way with positive emotion, we actually create new neural pathways, and the neural pathways represent our behavior. And that's how we go forward. Because sometimes when you're having a sort of emotional attack, it's impossible to think your way out of it. So basically we have to breathe and use a positive emotion to almost like chase it away. And that mantra I developed, I'll just say to people is, you know, it's breathe in the light and breathe out the shite, you know what I mean? And most ordinary people think that that's great, you know what I mean? Unfortunately, my colleagues in the medical environment don't think it's a very good thing to say to patients, but, you know, hey-ho, you can't win them all, can you? So just to go back to that then, I just want to ask you, you know, because this is about straight talk, really. Do you face any resistance then, Aimee, to these woo-woo things that you're trying to introduce into the National Health Service?
Well, I've stepped out my spiritual closet, to be honest with you. I'm now at the point where I used to like carry my crystals in my bra and not be able to tell anyone and think it was like a dirty secret, because at the end of the day, there's a very fine line between spiritual awakenings and psychosis. There really is. A lot of them sort of, I'm very confused to what's what some days, to be honest with you. Oh, I'm so sorry. Someone's reading again. Yeah, that's it. So yeah, but now I'm at the stage where I can't deny it. I'm just stepped out my spiritual closet, and when I'm saying to doctors and people are saying, is it a full moon or is it Mercury retrograde? Because people are just seeing now in meetings that us humans down here are affected by what's up there, and I'm just planting the seeds, and then everyone in the office is like, what's going on, because they can see it. And yeah, so I think there's a big, massive change. So, like Reiki is obviously used in cancer services, isn't it? You can get a band 5 practitioner role within NHS for cancer, which is amazing. I've heard of it actually being used in NHS for mental health in Liverpool and things like that. So it is getting out there. And I think even if you look at the policies which are coming through in mental health now, they're using the word spirituality as well, which I'm seeing, which is quite nice. So I used to come, there used to be a bit of a wall there and a blockage, but now people cannot deny the fact. So a lot of the patients on the wards are saying, what was that you did with me at Reiki? And they're asking the OTs for it, or the patients are saying that having a session of Reiki is best than taking diazepam. So when people are saying that, we can't ignore it, can we?
No, and I think, just to be clear about it, I've got no problem at all with medicine when it's used in the right amount for the right condition at the right time. I've got no problem at all, because I think that we need to work together, in collaboration. We need medical and non-medical interventions working together for the benefit of the patient, and the thing is, above all, do no harm, right? I think that we've got to look at the harm that we do sometimes with over medicating. I think medicine needs to look at that, but also we need to be responsible as well about some of the non-medical interventions as well. There needs to be some sort of degree of, if you mentioned the groundedness in this thing, so we talk about centering and grounding, which to me is important, and things that go along with that are things like Tai Chi, Qigong, yoga, hatha yoga, yin yoga, all these different yogas, and these different healing modalities. A lot of people don't know this, but I'm trained in trance mediumship as well, and I did a lot of work in the spiritualist church as well, and I used to be a healer there, and that was all part of my journey. And what I tend to do now is I just put my hand on my heart, and I just trust my intuition to guide me, if you like, to the next stage of what I'm supposed to learn about. And people say to me, well, you've got all these qualifications, right? What are you going to do next? And I honestly say, I had no idea, because I literally live one single day at a time, but I trust this inner guidance to guide me, you know what I mean? And then they say to me, well, what's your 5-year plan? Honestly, Aimee, I haven't even got a 5-minute plan the way it works, because my head can think, oh, right, I must be going there for that. And then suddenly I find myself like 3 miles away in a different place. And all sorts of coincidences happen. I think, oh, I must be being guided. But what if this force is an evil force that's guiding me? Well, I think I'll stick with it, because it seems to be helping me. I've never felt better in my life. It seems to be helping other people. I think I'll stick with it. Here's a hard question for you. Have you ever had anybody say that you're introducing evil forces in when you're doing Reiki, and try to prevent you from going any further with that one?
No, I haven't. Yeah, no, I've heard, not from a personal experience, I've heard of that from other people. Well, I was, the other day, I was in the Globe, I was featured in the Globe because I offer Reiki to children, and I thought I'd have a little look just at the comments, and then there was the usual pseudoscience on there and all of this, and yeah, so it's still out there, but I haven't had personal experience.
I've had people trying to block me from going to places and stuff like that, and I just like open my heart and send them love, you know what I mean? And I do, and it seems to work, because I've got no fight with anybody, because I used to be so entrenched in old ideas and stuff like that. I don't know whether you follow any particular religion. I haven't got a religion anymore, other than the feeling that I have, and my view is, if I'm open and flowing, I just keep going. I don't even have to work out what's doing it, and if I feel blocked, I step back, sit down, open my heart up and say, what is it you're trying to show me? Because, I'm trying to learn like everybody else, but Reiki, the principles of Reiki are beautiful, but I do feel at a deeper level that Reiki's been upgraded as well now, with this great shift of consciousness that's coming in, and in 2012, in 2011, right, I got a sort of a voice that said to me, you need to tell them about the upcoming shift, right? Because I get these sort of it's like a big train of thought that comes in. It's like a voice, but it's a really powerful thought. And I say to it, what's the great shift? And I get we'll tell you as you go along. And I ended up doing a talk about 2012, and the 21st of December, 2012. And apparently what happened then is because of some sort of astrological realignment of the planets, right? A whole load of new energy started to come in, which was like a great big cleansing tide of energy. And what I've learned over the years is, and this is for me, is it's supposed to be associated with the feminine side, the sacred feminine, you know. And from there, Aimee, and this is all new to me, you know, I got then a link to Mary Magdalene, the sacred feminine, Isis, ancient Egypt, Imhotep the healer, and all this stuff, you know. So, and honestly, before that, I was just like this scientist who was trying to come to terms with all this stuff that was flying into my head, you know. So can I just talk about one thing here? I have friends down, mostly in Dorset, but what they're doing is they're sort of developing, right, and it's spreading quickly, what they call Conquers Earth schools, you know, and it's about a restoration to natural education and stuff like that, you know. And I'm sort of very much involved with helping people to get involved in home education and restoring to nature, you know. So if anybody's interested in that, I can put a link up after this talk. But I think more and more people are seeing that maybe the standard curriculum system that we've got, the problem is that it's standardized and it's trying to have everybody, right, work like automatons on the same level, you know. And I'm really big about this because, you know, I read a poem years ago and it really sort of brought it home to me that our children are not our children, you know, they come through us. And you see, when I do this now, I get the big thing up my spine. They come through us, not from us, you know. And I think that's where we've gone wrong. We've misunderstood that really parents really are supposed to facilitate and nurture an environment as an individual seed, like the child comes through with its own specific gifts and abilities, you know, and its own strengths, you know. And this is important to me because I think what we do is as soon as the child's born, we hijack it really, and we try and socially condition it into what other hierarchies want, you know. And I think that's where we've gone wrong. And I started to see this a long time ago. So I'm involved with people from across the world now who are trying to help keep the kids clean right from birth, and for the parents to learn off the children, you know. And I know that you're interested in that as well. So I'll shut up and give you a chance to speak.
Yeah, that, and I say that's my passion. So it is the future generation, the mental health of the next future generation. And sometimes it is too late when we work with the adults, if I'm honest with you. So that's why it's so better just getting in there early. And yeah, you've talked about schools and homeschool, and I wanted to homeschool my daughter. That was my plan, being a CAMHS nurse, working in children and adolescents mental health services for like nearly 20 years, just seeing the stress and the impact. It's this education system isn't for our mental health and the well-being of the children. Children aren't meant to sit down and be quiet and just listen to one person for so long. It's not in their bodies. And as I say, I work with children in the NHS service medically, but I work with them energetically in my business, and I'm being blown away by these kids. So here's me teaching Reiki to them and teaching them breathing and things. I'm like, I'm the student here. They're mind blowing that what they're telling me. These kids can see auras, they can feel energy, they can see energy. My little girl's 5, and although she picks things up off me, like you were saying, I never force her to do anything. She's her own person. It's her own path. But she's just been sent to me as a little gift, that what she knows and what she can see is just absolutely phenomenal. And many, that's not even the right word, that's tongue twisted. But yeah, so many of these kids are just coming through with these gifts. And the thing is, the likes of school were blocking their creativity, and they just need to be themselves. And even the likes of your ADHD children and things like that, I think they're here to teach us a lesson, to show us that this system isn't working. It needs to change, and we need to listen to the kids. When I drop my little girl off at school, I'm amazed at how many of the children are just screaming, crying, trying to run out of the gate. It's really distressing. It's not working, and I think we need to have a big shake up. It's not working for the teachers. They're stressed. They're just doing tick boxes. It's not working for the children. So yeah.
No, I agree. And I think it's almost as if there needs to be a disintegration of systems right across the board, you know, and I think it's people like ourselves who can see this clearly, and we almost like need to pick up the pieces and recreate something else now in a completely different way, not based upon profit first and capitalism and all that blah, 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 you know, but based upon a heart-centered approach, really, you know. And my thing is, I've written a program called the I Am Approach to Health and Wellbeing. And what I Am stands for is, well, we know in spiritual terms, the I Am presence is basically the core of the individual, the soul. But I Am, in my thing, is it's internal asset management. So it's a strength-based approach where we realize that each individual soul or child is coming through with its own set of gifts. And you can call that a vocation, if you like. Each child will have a specific vocation that, if they're allowed then with enthusiasm to express these gifts, right, it will almost like be keys or different instruments in this great big orchestration of life. Does that sound good, this?
That sounds lovely.
Yeah. So really, we're each coming along with a different instrument, you know, but we're playing it right in tune, in harmony, really, with the universe and stuff like that, you know. And I know some people might think, oh, it's all woo-woo words and stuff like that, but I'm very much into what they call quantum consciousness now, really, about quantum physics. And this, to me, we talk about 12 different dimensions. It makes perfect sense to me, you know. And ancient religions, including the Mayan religions, you know, they believed that we all have different abilities within us. There's 12 intelligences within each human being. Each represents a different sphere of consciousness, you know, and that's what we're moving towards now. You know, it's fascinating. I think we're just on the cusp of turning, you know. So we're coming out of, if you look at yoga philosophy, we're coming out of what's called the Kali Yuga, which is like the bottom. It can't get any worse. And we're on the upturn now, thank goodness, you know. Yeah, so we're coming out of hell and we're going through a purgative or purgatorial cleansing process back on the golden stream, you know, which is called Satya Yuga. So I've looked at a lot of this stuff, and at first when I got into it, thinking, what a load of old crap, you know, and now I can see very clearly that even people 5,000 years ago had much more of an idea of what was going on than we're supposed to know now, really, you know. But almost like, I think that we're at the bottom of the rung as far as knowledge goes about this world, you know. So just to talk about womb ecology, you know, you came along, you know, quite a few years ago, and you listened to a talk I did called The Mummy's Curse, you know. And what I realized is the environment that the child gets born in, you know, the embryonic and the fetal developments, that sort of water of life, you know, the liquor amnii, the amniotic fluid, what that contains from a biochemical point of view and a mineral point of view is important to the growth of the child, you know. But what I've also learned, and by the way, there's no blame here that I'm going to say, there's a responsibility, but there's no blame. The mother's emotional state can pass biochemical information on through the placenta to the development of the child. So it's so important to me now is that if we can help women who are pregnant, going through the whole pregnancy process to learn about being calm and talking to the child and talking to the water and all that sort of stuff, if we can start to help women understand that as well, and also about birth as well, you know, not shooting the child out into bright lights and stuff like that, you know, but maybe even forest births and water births and stuff like that, you know. I think that that's so important, and I think that we're sort of naturally going back towards those sorts of things. And also, what do we do with the placenta? Do we keep it? Do we chuck it? Do we make soup out of it? Do we eat it? What the hell do we do with it? Because that oxytocin bonding thing is so powerful, really, you know. So rather than becoming this aseptic, hygienic society, maybe we need to get back into the blood and gore of stuff, because that's part of natural stuff. Have you got anything to say about all that?
Yeah, so you've touched on a lot there, and you're right, as I say, that it does start in the womb space, and that's what got me into, as I say, I was pregnant, I was depressed, I was having a spiritual awakening, I was having a real bad time, got a family history. Everyone in my family, both sides, father and mother, have been under mental health services, so I've got a lot there. And as I say, I was just didn't want this to be passed down to this child. And then obviously, I'm sure everyone knows, but also like as daughters, we not only in our mother's womb, but our grandmother's womb as well, because when our mother was in our grandmother, obviously her ovaries and her seed. So people find it quite hard. How can we carry all this crap down from like generations? If you think about it, we were physically in them. So that's how it's passed down through the blood, through the womb. Obviously epigenetics have spoke about it, and there's a bit of science flung in there. What's his name, the guy, Dr. Bruce Lipton, epigenetics, look into that. And we can carry it down, but what I say is, you just said there's no blame. The positive news is we can carry down trauma, mental health, abuse, addiction down the bloodline, but we can also carry down healing and positivity and change, can't we? So that's why it doesn't matter what's happened in the past. As long as you're aware of it and you're willing to do the work, we can heal from that, and we can shed and we can cleanse. And another passion, I've got many of them, is hypnobirthing. So working with pregnant women, and just giving them rights. So my daughter was actually the most overdue baby that they've seen on the Wirral, because when I was pregnant, I felt very strongly that I was healthy and she was healthy. And I had all these doctors telling me every single day, you do realise that you're going to either kill you or the baby. And that's were their words. So every single day I had to go up to the hospital and being told this by the medical system. And it's really interesting, because I'd say to them, being a nurse, I looked at the literature and the research and say, why do you say this? And it was because there was one study done, I think it was like in the 1950s, on like 8 women. I'm like, oh, this comes from one study. And then another study had been done just before Amelia had been born, which proved the opposite of that. So I was saying, where'd you get your evidence from? Well, this is my evidence. And they were all like stunned and stuck back, because we don't update things, do we? It's just one thing has been said and they carry it along. So I was really shocked by the medical system when I was pregnant, how they tried to take away my power, how they think that they know right. And I just became my intuition became a lot stronger, and I just became really aware of how important natural birth is. And yeah, I just said, no, I want to wait. And she came on it was funny actually, because I felt very drawn to the moon. So the first thing I did when I got pregnant was to see when a full moon was. And it was like weeks and weeks off. So I thought, oh, there's not a chance she's going to come. And she came on the night of a super full moon, obviously. Yeah, like 3 weeks later or whatever it is. So she was waiting for that. And yeah, the most overdue baby. But it was really interesting, because they were all commenting how strong she was. She had her head up. So it wasn't that she was late, it's that she just came at the right time. I don't think there isn't such thing as late babies. It's a body, and this baby will come when it's right, not when a doctor says this is what date it should be or what time it should be. And it's crazy if you look at other countries. So like in France, they have different dates. So is a different woman, a different woman and a baby different in a different country? Do you know what I mean? It's just... So yeah, another passion of mine, what you just spoke about, and it's really important.
But this is what I was talking about, quantum consciousness, is we have these 12 streams coming in. And what we sometimes is they come in that quickly, we can't emotionally handle them and process the information. But if we can learn mindfulness to get some space to then regulate what's coming in then, right, that gives us a much better chance then of understanding all these different streams of consciousness that are coming in. So that's another thing. But you mentioned France. For a long, long time now, I went to a Breath of Life conference about 20 years ago. I met somebody called Michel Audon, and he's a French doctor. He's a naturopath, right? And he's developed this site called wombecology.com, right? And if anybody's listening and they feel guided or attracted towards this, just wombecology.com. If you go on there, you'll find loads and loads of inspiration. And lots of people who work with him are things like osteopaths, chiropractors, and stuff like that. Because just things like postural alignment in the early years is so important as well. Because if we consider the forces and the flows that actually guide the planet and guide ourselves, if we're out of alignment with that, it puts a hell of a stress on us. Now, the force of gravity is phenomenal. And if we just put our head forward, the force of gravity then is weighing down upon us all the time then. And so we get postural changes. So very sensitively, we've got our head down. We'll try and change our back in a way to try and get upright again. And this is our postural abnormalities. There's so much that we don't know. But my big thing is that children should be assessed properly at birth. They go through the APGAR process and stuff like that. but there's all sorts of other things that they need to be looked at regarding postural alignments and stuff, you know. And the earlier that we can sort of help them to realign with their natural energetic flows, I think we've got a much better chance of them expressing themselves. The most important thing is lightheartedness is the key. You know, if we're doing something, Amy, you know this, if we're doing something that our heart's not fully in it, then we're only half-heartedly living our life, you know. And it takes a lot of courage, even as an adult, you know, it takes a lot of courage to say, I'm completely in the wrong direction here, right? But you can almost tap on your heart and you can say to your heart, because this is what I do, the inner wisdom is within you and it's listening to you because it's your innate intelligence. You can say, look, I've tried everything here. This is how I stopped drinking, by the way. I've tried everything. I'm going to surrender everything now to you, the whole management of my life and my career and my finances and my relationships. I'm putting them all in a package. I'm shoving them in there now. From this moment on, I'm asking you to guide me through the rest of my life. And then the miracle happened. I woke up the next day. I stopped drinking. I tried for years, you know. I lost my wife, my kids, my job, my liberty. I was homeless, you know. And then I did this under the guidance of somebody else. I went through that process. I woke up the next day and I haven't had a drink since. But not only that, I've almost like been guided down this alternative path. And then I woke up one morning and my head said to me, okay, you need to go back and do a PhD now. You know, as your head says that to you, you know. And I said, all right then. And it was like a miracle opened because, you know, I'd already got a degree in biomedical sciences, but that sort of put me on the pathway then to go to Liverpool University, to meet all these different people who, you know, so miracles do happen. You know, and I believe, I don't believe in religion as such, but if there is such a thing as angels and guardian angels, I'm quite happy with that. I mean, I was brought up Roman Catholic, and I'm quite happy to dip back into that, you know, and speak to these things, you know, and, you know, whether I'm on my way back to Springfield or whatever it's called these days, I don't know, you know, but I've never felt so enthusiastic, so clear that I've got a purpose in life now. And my purpose is to share my experience, my strength and my hope with other people. And something seems to happen in that process, you know. And there's many of us, isn't there? I mean, we know a lot of people. You know a lot of people that I know and vice versa, you know. And by the way, I met Justin Hopper from La Vida, Liverpool, a couple of weeks ago, you know. I spent a good couple of hours with him. And he's a nice bloke. And he's trying to get stuff out there as well, you know. We're hoping that La Vida will take over the world, you know, and that would be a good thing. But also we've got a friend and we call Bev Williams, you know, and AJ, you know, and I think that there'll be sort of hopefully collaborations that go on there as well, because it almost seems like things are automatically happening and draw people of like minds and like hearts together, you know. So I've said a lot because, I mean, once I get going, it's hard to stop me. But what else do you want to talk about?
Oh, I don't know. I was just trying to follow the train and the thread of where we were up to. Yeah, you spoke a little bit about Tai Chi. So so I tried Tai Chi a couple of months ago for the first time, and I was just blown away that this energy that I could feel in my body. Obviously, your chi, isn't it? Yeah. But I've been taking my patients who experience psychosis, and a lot of them maybe having a bad day, they'll be feeling anxious, and when they feel anxious, their voices are more derogatory and more just negative, and they'll go to the Tai Chi session and they'll just say how amazing they feel afterwards, and they're asking to go all the time. They miss it when they're not there because of the positive effect it's having on their mental health. As I say, their anxiety reduces and then their voices get better, and yet there's no side effects. They engage in it, they love it. We go as a community together, and it's a China spirit. I've noticed that you've been as well, haven't you? Yeah. And just to comment on that was really amazing to see and to feel the energy myself in the body.
Well, I mean, something I got into as well is the chakra system as well, you know, because I mean, I'd heard about these in my head, because it was still in biomedicine. It was like, oh, that's bollocks, I'm not having that, you know. And once again, my head gets turned around to say, hang on, Joe, look deeper into it, because you may find a correspondence with medicine. And what I've been able to do is I can align the chakras now with the 7 major endocrine glands as well, right? And so, you know, we start off with the root chakra, which is basically associated with personal security. And that's associated with the adrenal glands and adrenaline, you see. And then we move up to the sex hormones then, and then we move up into the sort of solar plexus, where we've got the energy centers and the pancreas, you know. So, but what I want to really talk about now is maybe to the end is, how can we redevelop natural immunity, because it seems to be on the cards at the moment that we need to take artificial things to enhance our immunity, when I don't personally believe that. I feel that the more our heart opens and the more that we express ourselves, the more our immune system balances out, because there's a lot of sort of concern now that maybe when we chemically or such enhance the immune system, a lot of autoimmune diseases can actually come as a consequence of that. Now, I'm sort of talking half in code here because, you know, I have to. But what I'm trying to say is that my understanding is, and what I've learned is, the heart and the throat and the connection is important, because anxiety, the root of anxiety is angustia, and it means a tightening or a narrowing of the throat. And that's why when people get afraid, even though they're not aware of it, their voice goes up and their throat collapses and closes, right? And it's part of, maybe we can talk about this at another time, it's part of the fight and flight response. So if you feel like you're being choked at the throat, it's because your body is picking up a signal that represents danger, right? And my big thing to people with anxiety is, because we do a lot of breathing techniques, is try and learn about mindful breathing. And when you feel the grip coming in, you can become more body aware then, so you can nip it in the bud earlier, right, and take a step back then. So that's just something. But to go to natural immunity, what are your thoughts on that without getting us into trouble?
Yeah, exactly. So prior 7 years ago, as I say, I'd be shoving anything in my body, on my body, not thinking opposite. And then when I became pregnant, I just became really aware of how precious the body is, and it got me into natural medicine. I don't know if you heard of, but you probably have, if you had any experience of homeopathy.
Oh yeah.
Yeah. So you talk about synchronicities. I was really looking for a local homeopath, and I couldn't find one anywhere. And then I basically found one who was in a local, don't know if you know, Dr. Adrian, what was his name? Winter, or anyway, doesn't matter, but he was based locally, and he introduced me in. So bearing in mind this was a GP session, I thought I'd be in and out in 5 minutes. He kept me there for an hour and a half. Yeah. And even though I was there this is what blew my mind as well, I found really interesting. Even though I was there about my daughter, he was just interested in me as the mother. And he was saying, before he even touched and looked at my daughter, he wanted to know about me and heal about me. And yeah, that got me on my natural healing journey. So my daughter is 5.5 and she's never had any medicine ever for anything. And we've used homeopathy. And what I love about homeopathy is that it heals the root cause, and it also increases natural immunity. So for example, if you've got, like, she had tonsillitis, if you had an antibiotic, obviously that just sort of, it doesn't clean or cleanse or anything, it just covers it up, and you can have reoccurring throat infections. The homeopathy literally nipped it in the butt. And calcicarb it is, which is the scrapings of an oyster shell, a couple of doses of that, and it cleared up. And again, I was just so glad I was introduced to that. This is natural medicine that increases the natural body's healing, isn't it, and gets to the root cause. And it's just an amazing tool that we have. So again, things like stress are massive for immunity. So doing things like deep breathing and mindfulness and meditation, like you spoke about, and improved sleep. Yeah, it's really important, because we've got winter coming now, haven't we? And the body is going to start getting all of these like nasty diseases and things. So if you prepare for winter, with all the natural things out there, then yeah, stress, sleep, and homeopathy, natural medicines, it's can really set you up for this season. Well,
I've been a member of the Radionics Association for over 25 years, and what they're about is, it's associated with the Soil Association as well, right? But it's all about homeopathy really, and vibrational medicine. And that's the root of my understanding now, is that all dis-ease or ill-at-easeness is a vibrational mismatch, which is in misalignment with our natural core essential selves, you know. And I'm there now with you. Our house here right, is flooded with homeopathy medications. We take our animals to a homeopathic vet in Shropshire, you know, and so I believe in that. I teach that, or I used to teach that at Edgehill University, you know, and Samuel Hahnemann sort of things. And homeopathy means treating with similars, you know. So for example, you know, if you have an eye problem, you can actually use an onion diluted millions of times, you know, to get back to the essential thing, which works at the root cause of the problem then as well. So it's sort of resetting the vibrational disease or dissonance, you know. So yeah, I agree wholeheartedly with that. Now, some people will be so entrenched, right, in medical stuff, right, and medical authority, you know, that what we're saying here might sort of cause a bit of a sort of trigger within them, you know. Well, I have to just put a disclaimer in here that really, I think each individual is responsible for making their own choices, you know. And I also teach, because I do a lot of stuff, you know, I teach medical ethics as well, right? And one of the sort of the underpinning principles is informed consent. You know, yeah. And my big thing is, because I'm a sort of medical research fellow, is I have to look objectively at both sides of an argument. So I have to try and weigh up the evidence on both sides. And if I'm not sure, I don't take any action until I get some more decent evidence, you know. And then based upon seeing both sides of the evidence, I almost like stick it in my heart. And I ask my heart to choose, you know. And I think that the heart is the greatest discernment apparatus, right? Because it works from the truth and it will tell you the truth, you know. And maybe what I choose might be against the majority of the population. That doesn't matter to me. At least I'm being true, Amy, to myself, you know. And if I make a mistake further down the line, I can say, well, I'm sorry, I've made a mistake, you know, because I'm infallible like everybody else. But I'm not, if people say to me, what do you think I should do about a certain thing? I'll say, hang on a second. I can't tell you what to do, but I can just give you some principles. But I'm going to say is that you'll have to take all the evidence and make your own mind up and then accept the consequences of your choice, you know. And I think that's the only fair way to go through. And I also get a clue that if people are trying to push stuff on me that's against my heart, right, that causes me to look even deeper at sort of the motivations underneath stuff as well. I'll have to stop, you know, because I'm going to get into trouble again. But, you know, but I think most people who are listening to this will have an idea of where I'm coming from here. Over to you, Amy. Quick, get me out of this.
Don't, I'll be treading even deeper mud. I'm still in it, aren't I? I'm still in it, yeah. But so yeah, just what you were talking about the natural medicines and stuff like that, and it's about informed consent, and also if someone engages in that. So if you are a person who wants to go down the medical route and medications are working for you and they're improving your life, then like you were saying, that's your path. That's amazing and that's great. But again, if you've got the path of wanting to heal yourself naturally, and going down that route, then yeah, it's just very important to be supported about that, and for more people, like-minded people like ourselves who are in the medical profession as well, to be able to talk like that and to give those people support, because it's about not being pushed something not being pushed upon you, but it being a natural choice, which is massive. And people use the word placebo a lot. Oh, Reiki must just be a placebo or this and that. But if there's no side effects from it, it's working from that person, that person's having improvements and they're engaging in it, then does it matter?
Yeah, and then, you know, we say above all, do no harm, you know, and I go as far as I can to feel my way through stuff that I do with people, you know, because I do it like a deep remedial massage therapy and trigger point therapy on people, you know, and I'll use my elbow and it'll be digging deep into their shoulders, you know, but after 2 days, they're unblocked and stuff like that, you know. So I'm quite sensitive to like picking up energy and stuff like that, you know. So there's lots of different things. We're sort of coming to the end nearly now, but I just want to sort of recap and just say, you know, Wirral, I feel, has got quite a healthy community. Have I upset you in some way?
It looked like I was in a cave then. It's gone dark, hasn't it?
Yeah. No, I was saying that the Wirral right? It seems to be sort of, it's so enthusiastic about natural stuff. You know I've got lots of friends who are teachers of yoga, various disciplines of yoga, you know, Tai Chi. I mean, I've done a lot of martial arts in my time and stuff like that. And when I was learning as a kid to do martial arts, it was to protect myself because I felt frightened all the time, you know, and I got quite good at it. And I still felt as frightened, you know, and I realized that I was trying to sort of create a sort of an external toughness, but really my problem was emotional sensitivity, you know. So just to go on to the subject of emotional sensitivity, I think that there's more and more people coming through, especially with this shift, who are becoming more and more emotionally sensitive. The more that you try and compress it and contain it, probably the more ill you'll become, because this is all now about expressing the emotion. But to use a phrase, it's got to be transformed through an open and flowing heart. Because if the energy comes in and fight and flight, you get a gut grip and then it goes straight to your head then, right? That can come out in a very destructive way, because I was there myself for a long time. But if you allow your heart to open, transform the energy that's coming up from your solar plexus through an open heart, what it does is it will provide you with courage and clarity to go forward and make more healthy choices then, or at least that's the way I explain it, you know. And more people are beginning to understand this, that there's a neuroscientific basis for all this stuff now, you know, and that's what I'm trying to carry forward now. I'm trying to lead with science first and foremost, and then show people how to do these things, you know. So just on that note, and thanks very much, love. It's been an absolute pleasure talking to you, and we're definitely on the same wavelength. But have you got any sort of some practical tips maybe for people who may be finding things tough at the moment? Some simple, straightforward, practical tips that may help them.
Yeah, so as I say, this is coming from the reports from my patients, and these are people who are that I'm meeting on the wards and in the community. So this is serious mental health. And what I want to say is, a lot of people say to me, Jo, I can't meditate, my head's too busy, there's no way, and they won't even give it a go. And I work with people who are suicidal, who are hearing voices, who've got bipolar, who've got ADHD, and if they can do it, you can do it.
Yeah,
really can.
Well, I agree, because I was one of those, you know, because my head would talk in, and even when I started to practice. But I'm writing a book at the moment. I think I might have mentioned it before. It's called the F-off approach to health and happiness. Right? Seriously, Dr. F and Joe, the F-off approach to health and happiness, and it's F-off stands for, and this was given to me by me guidance, focus on feelings first, right? Because that's how you get out of your head and into your heart. If you put your hand on your heart like that and you press on it, and you imagine that you're breathing in and out through the heart, so you get the feeling of it, what actually happens over time is the head starts to calm down and it focuses more and more then. So this is about focusing on feeling. It's not to try and put more thinking in here, because our thinking's it's already too crammed and too quick. So by using a breathing technique, and I'll just say what the breathing technique, and I use this with kids as well. I do an angel thing as well, and I do it with parents as well. It's this is called cradling the sacred child, right? Yeah. So you can either do the wings one, or if you're a parent, you can imagine that you're snuggling a child in there, and the idea would be is to try and listen in to the child's heartbeat and your heartbeat, and when they merge together, then it's almost like a magic thing happens. But just to say, it's just breathing in, 2, 3, 4, 5, stop. Out, 2, 3, 4, 5, stop. In, 2, 3, 4, 5, stop. Out, 2, 3, 4, 5, stop. Now, your head will jump in initially to say, oh, this is bollocks, I can't be bothered with this, I haven't got time. You just have to say to your head, don't fight with it. Just say, let's try it out and give it a fair trial, because I think it's going to benefit both of us here, right? So it's breathing the feeling in and out. So remember the mantra, breathe in the light as a feeling, collect all the crap that's in there, and then breathe out the shite. Now, 3 10-minute sessions a day for 30 days, right? If you just make that a priority, and people say to me, I haven't got time for that, I'll swear to you that you'll be able to manage your time more effectively. you'll have more energy, you'll have more clarity, and it's almost like your intuition will start coming up then to guide you forward. So that's my suggestion to people, you know. And lots of yoga teachers are teaching these similar things now, you know. And the other thing is, find what works for you and do more of it. Because if you haven't got joy in your life, you know, that's where I came to. What's the point? So this is a way to put you back to your soul's purpose and to a purposeful life. I feel like the Pope now. Over to you, my love, just to say a few final words.
Yeah, and just a little pointer, where the very first time I was introduced to mindfulness and meditation was actually within the work. It was some psychologists, and it was when I was in a very good headspace, and I had to run off a few times. I was in the toilet, literally swearing, kicking the doors, like, what the F am I doing here? And my head, and I just couldn't do it, and I give up. And I hated mindfulness and meditation, but it's a load of rubbish. My head's too busy. And then when I had my mental breakdown, I got into it again. And I wish someone would have said to me, if it doesn't work the first time, to keep going. It not working the first time, just showing you how much you need it, and to be consistent. And I tried it a couple of times, and it got easier. So don't give up the first time if you do it and it's not working. Like you said, find what works for you. There's different types of meditations out there. There's guided ones. You can just do your own. Whether it's dancing and just moving and getting that energy around, you've got to find what works for you. Having a good sing, having a good dance, but not keeping things in, these emotions that are dragging us down, finding a way of releasing, whether it's singing and dancing, having a cold water shower, doing your meditation, breath work. There's so much amazing things out there to manage our mental health and well-being, and it works. I really see that it works. So whether it's for yourself or for your children, to introduce them to these amazing techniques and tools, because life is going to be throwing a lot of stress and crap at our children. And if we give them these tools from a young age, they can develop and use this fight or flight adrenaline. So yeah, that's it. Over and out.
Considering you were a bit concerned about what you were going to say, I think it's worked out perfectly well, don't you?
Thank you very much. Yeah, it's me, and it's me, critic, that voice that I should just not listen to.
You have to breathe it away, breathe it away. Amy, love, thanks very much. I'm absolutely certain that we're going to be meeting maybe quite soon, actually, you know, in the flesh. And I think there's like a conglomeration of things happening, you know, so we'll just have to play it by ear and see what happens. So thanks very much, love. And thank you, everybody, for listening in. And I hope that you've got something from this. And on that note, Amy and Dr. Joe signing off.
Good night.
Good night. God bless.